pylori is another bacteria where the name itself gives us a decent amount of information. Helico describes its helical shape, and pylori tells us where we can find it, near our pylorus, in the antrum of our stomach. And Helicobacter pylori isn't a rare infection either, it's really important. In fact, studies show that almost 80% of adults in developing countries have been infected with H. pylori at some point in their life. Even in the US, almost 50% of older adults have been carriers. We decided to name the Helicobacter pylori illustration the helicopter pilot. So here's our helicopter. We chose the helicopter because it sounds like Helicobacter. That's pretty obvious. But another nice coincidence is that helicopters have these propellers which spin and move the helicopter. Similarly, Helicobacter spins and whips its flagella around to propel it around the stomach. So H. pylori is modal. Now we'll draw our pilot, who's cleaning the window. I guess we're illustrating the less fun parts about being a helicopter pilot. There are two things here, though. We gave him a similar curly mustache to Vibrio and Campi. Again, these are the three curved negative rods. But remember, Helicobacter is more helical. The other thing we see here is the ammonia bottle, representing that it's urease positive. Of all the organisms that are urease positive, for this one, urease is probably the most important. Urease again splits urea into ammonia and CO2, which helps reduce the acidity of the environment, and it's absolutely necessary for H. pylori to invade the stomach. So it's a target of two important screening tests. The first is the urea breath test. For this test, patients would swallow urea labeled with radioactive carbon, which is then split into CO2 and ammonia, and this CO2, now with the radioactive carbon, is exhaled. If radioisotopes are detected on exhalation, then that means that there's a urease-positive organism in your stomach. The second clinical test you can do is biopsy during endoscopy, and then directly check for urease with a rapid test. So in summary, H. pylori is urease positive. Next, we'll also show that it's oxidase positive, so we'll give our pilot the familiar oxidase positive blue ring. All of the curved rods are oxidase positive. Here we have all three dudes lined up side by side with their mustaches and their blue oxidase positive rings. H. pylori also causes ulcers. Roughly 95% of all duodenal ulcers are caused by H. pylori. So if a question stem says duodenal ulcers, then it's a safe assumption that it's H. pylori you're dealing with, and you should treat the infection. The mechanism by which the infection causes ulcers is not really understood, but it's suggested that chronic infection causes increased acid production by either reducing somatostatin or increasing production of gastrin. Anyway, to represent ulcers, we'll add some bullet holes in the side of the helicopter. Their rough borders and punched out center look a lot like ulcers. So if you don't treat them, they are at risk for developing conditions more worrisome than just ulcers. Specifically, they're at risk for developing adenocarcinoma of the stomach, and in fact, almost half of gastric adenocarcinomas are linked to H. pylori. In astrology, the sign for Cancer is a crab, so we'll draw a crab on the side of the helicopter, and this again represents increased cancer risk. Aside from adenocarcinoma, a patient can also develop lymphoma of the mucus-associated lymphoid tissue, or MALT, and the lymphoma is referred to as a maltoma. The interesting thing about a maltoma is that if you successfully treat and eliminate the H. pylori infection, the maltoma will generally go away. So how are we going to represent mucus-associated lymphoid tissue? Well, after he sprays the window, which may be covered in bugs and all sorts of mucus, he wipes them down with these tissues. So now these tissues are mucus-associated, and he discards them. So this pile of tissues, you'll have to remember, are mucus-associated lymphoid tissues, or MALT. Now I should probably discuss how to treat H. pylori infections. They're actually pretty notoriously difficult to treat. They require at least triple therapy and sometimes even quadruple therapy. So the standard triple therapy protocol was challenging for me to remember, but I think we've done a really great job to make these memorable. So the first medication you'll want to start them on is a proton pump inhibitor. So this is to counter that increased acid production caused by chronic H. pylori. To represent proton pump inhibitor, we'll draw this gasoline pump going to the helicopter. However, the hose from the pump is being squished and blocked by this bomb. The bomb has an H+ written on it because it's a proton bomb. So it's a proton bomb inhibiting a pump, or a proton pump inhibitor. Additionally, we made the backed up pump look like a duodenum with leaking ulcers, just to remind you that the ulcers most commonly occur in the duodenum. The second treatment in this triple therapy is represented by this ammo box. What's an antibiotic that starts with ammo? Yep, it's amoxicillin. So that's 2. Now the third and final treatment is a macrolide. So we'll draw our macrolide crows. And the standard treatment protocol actually says clarithromycin specifically. So we'll add a macrolide crow standing on top of a sign that says keep clear. This clear should help trigger your memory for clarithromycin. So again, if someone is colonized with H. pylori, you'll want to treat them with a PPI, amoxicillin, and clarithromycin. And that wraps up H. pylori.